All right, we've talked about what simulation is and why simulation. Then how do you prepare? Kathleen, you mentioned about getting a good night's sleep. How do you prepare for simulation?
I like to look over whatever we've lectured or what's going to be on the upcoming test, because most of the time that's the kind of, I guess, these processes the patients are going to have when we get in here. So I want to make sure to look over those notes, my personal notes. Later on, I like to go and, I think Jessica does the same thing the night before, go to Evolve and look at the skills, because out there we don't use them every day when we do go to clinical, and sometimes we miss our opportunity. But in here, I know, like, okay, I'm going to have a new skill, or she's going to give me something I haven't had. So I like to refresh myself on my skills. And the night before, I put all my stethoscope, my badge, any supplies I know I would use when I go to my clinical that I would use in Sims, and I make sure I put it in the car. That way, I'm like, I don't have to run home again. I'm like, okay, it's in the car if I left it there. And like Kathleen said the night before, go to bed early, be relaxed. So you get up in the morning to be here.
I always reviewed any drugs that we talked about in lecture that week, and just kind of made sure that I was comfortable with them, and just really, reading over lecture notes, maybe even old simulation times before of some patients maybe I had, or some of the other patients that were given to some of the other students, just to give me some different scenarios and ideas of things that we did.
The importance of getting a good night's sleep, because it's not going to be beneficial to you or to your patient if you're not mentally, emotionally, and physically prepared to care for them. Simulation is very intense, but it's a great learning environment, and it's going to challenge your critical thinking, and it's going to give you a chance to perform, the hands-on care. Some of the very few things in nursing school that you can memorize, but one of the things that I memorize is the lab values. I'll put sticky notes everywhere, like my bathroom mirrors, so that when I'm putting on my makeup or whatever, I can really, I can focus on, the lab value ranges and stuff. Practice documentation. Look up a nursing diagnosis and see what interventions are helpful for this, and try to write them out. What would you do as a nurse? Many times Ms. Gerald's will use some of the diseases and processes that coincide with the unit, like Kim was saying, and you can apply those to the patient that you're writing about for Kingwood Hospital. And remember, I said some, but not all, will Ms. Gerald's use on your unit that you're working on. Again, Kim said about practicing different skills. It's really important that you don't practice one way, like for instance Foley insertion. You may want to use the opposite side of the bed that you're most comfortable with, because when you're on the floor or you're in simulation, you're not going to be able to always choose that particular side. Ms. Gills is not going to test you on a skill that you don't know. She will only require that you know what you know at your current level. The Sims Hospital is not a lab, so don't come to practice. Come prepared to execute the skills as you would in a traditional setting. Be sure that you come to the Sims Hospital with your your white shirt, your lab coat, your teal pants, your nurse jacket, and your white shoes. I like to wear the white compression socks because you're on your feet, and it kind of just gives you a little extra support, just to kind of make things more comfortable, because like I said before, it's very intense. Oh, and don't forget your name badge. You won't be able to get into the Sims Hospital without it.
Realize that when you're coming, that you are coming to Kingwood Hospital. This, as we said before, this is not pretend. This is a hospital. You will be taking care of actual patients, and so you need to prepare yourself that you are not coming to lab, that you are coming to the hospital, and it'd be the same as if you were going to Kingwood Medical Center or Northeast. You're coming to Kingwood Hospital for the day. So prepare yourself to treat these patients the same as you would in any hospital setting.
We talked about that I may give you some assignments, or you may have some patients that follow the lecture. That's one of the research. And in research, it tells you that we should thread simulation through the curriculum. And so we try to do that. But remember that we can also, and you mentioned that we can also bring back, you're accountable for everything that you have learned in the past. We're going to the future, but I can bring back anything in the past. Could you define, if I gave you the term scope of practice, what does that mean in clinical simulation? Do you remember? Your scope of practice is, and I hold you to the scope of practice. What is it that you have learned up to this time? So though an RN can maybe start IVs, well, maybe you're level 2. You have not had that training. So within your scope of practice, you cannot put in IV. So I hold you to your scope of practice, and that's what you have mentioned, that that I only hold you to the skills that you have learned, but I will refer to that many times as your scope of practice. Okay. Any other things that you would like to talk about, like to discuss?
Oh, well, our equipment, what you need to bring to simulation, it would be the same as the traditional clinical setting. You'll need your stethoscope, your pen light, a black writing pen, small scissors, and your hemostat. Some things that are useful but not required would be maybe your drug book, a nursing diagnosis book, maybe a little small notebook to write some personal notes, because Ms. Gerald gives a short lecture right before we go into the simulation hospital, and that might be kind of helpful to have.
We've talked about mannequins, and mannequins is not the word that we use in here. Those are our patients. But how do you deal with that? How do you deal with the patient that is not as responsive as the patient that you'll see in a traditional setting? How do you relate to, I guess, to that mannequin?
Well, you've actually been real helpful in that. When you first begin simulation, it does seem difficult at first because your patient isn't responding to you as a patient might in the hospital. But Ms. Gerald is here and does respond for the patient, so you quickly get into the rhythm of calling things out, and Ms. Gerald's responding for the patient. But you also find in the future, as I've been in the hospital clinical setting and had patients who were unable to communicate with me, and again, that was an opportunity for me to see how much simulation has really been of value, because you will not always have a patient that responds to you in a clinical setting. So SIMS really has been invaluable for me with that. I spent an entire morning one day in clinical with a patient who was unable to communicate, and I was much more prepared to take care of that patient because I had been in simulation.
And honestly, it can be frustrating because, this is a new experience, and it's not just, you're walking in and you're going to have a happy patient or an angry patient. That patient, is just kind of there, and it will take a while, a few simulation rotations for you to, get the rhythm and the hang of it, but it will come. And Ms. Gerald is, she can do many things at one time, and even though there may be 6 patients with 6 student nurses, she knows exactly what you're doing, and will answer if you just call out to her, hey, what's my, pupil dilation, and she'll get you. Just communicate with your patient as you would with a human patient.
Communication is the key.
It's important to talk to your patient.
It is.
Yeah. Therapeutic communication is very important. Even though they're just laying there, you still need to talk and it just helps the situation.
Would you like to share one of your most challenging simulation patients before we close here?
For my first simulation, my patient hung himself in the bed rail. And so we had to initiate CPR, and it was a team effort, and it was quite an experience. But we got through it.
Lisa had talked about
being comfortable with doing your skill on either side of the bed. And I had to suction my patient one time on the opposite side of the bed that I was comfortable with. So it really makes you to kind of look inside and think about, doing it from an opposite direction. So just remember that when you're doing your skills, I think.
Mine is like when my patient has a respiratory distress and I really don't know what's going on, and in the end he's taking a different medication that is not on the list.
Mine would have to be the day that I couldn't stop saying pretend. And every time I tried to do anything, I kept referring to my pretend patient, and everything was pretend. I learned very quickly that is not a term that we use in Sims, and have not used it since.
There's so many. Actually, I remember because I enjoyed it. My psych patient I had, which they couldn't respond back to me, but they had issues going on. They received the wrong med, but being able to communicate, even they weren't they were responding back, was helping me to realize like how more to be comfortable talking to someone, like they were saying, that couldn't respond back. And I think I enjoyed being able to, like, I know you can hear me and I know you can't speak back, but I want you to know they're doing what they can to help you. So I was able to, like, to me, I made them feel better even though they couldn't in any way show me. So I actually enjoyed that experience with a psych patient.
Absolutely.
She was wonderful, with her communication, because she was constantly talking to the patient, and even though they couldn't respond, I think she did very well with the therapeutic communication, and I think her patient had a more positive outcome because of it. I really do. And I guess my most memorable one was along with Jessica's psych patient, because we go through CPR. It's required that we have our healthcare provider CPR, but when you're put on the spot, sometimes the information may go out of your head, but it really doesn't need to. That doesn't need to happen, because it's very critical. It's life. It could be life-changing for your patient if you don't really know what you're doing. So in addition to some of the other things that we talked about, how to prepare, I would seriously review each and every time before you came to simulation your CPR protocol, because it's just critical. You need to know, jump in there and start compressions and get that patient some oxygen, because it's just very critical and very urgent. So that was a very intense moment, and Ms. Gerald's was raising her voice at us because we were just kind of frozen, with fear of what to do next. But as a nurse, you can't be frozen. You need to react, in a manner that is going to save the patient. So be prepared with your most basic skills, and things will go really smoothly.
And Lisa, that's a very good point. I would add to that too. Being prepared is being confident in those skills. Again, that same day, I remember when the code was happening and you and Jessica were with the patient, I was instructed to get the ambu bag. Of course, a lot was going on. It was confusing. There was a lot of commotion. I picked up the ambu bag and started back with it, and in the confusion, thought that Mr. Earl said something else to me. I ended up putting the ambu bag down, thinking that I was doing wrong. I should have had the confidence to keep it in my hand, because 30 seconds later she was asking me where the ambu bag was. So you need to have confidence that, yes, I need to grab that bag, I need to get to the patient with it, and stand by your decision.
Exactly. And you may be wrong, but the key is to go with confidence, and it's okay to be wrong in simulation hospital, because if we knew all the right answers, we wouldn't be here.
That's right. What I would encourage the viewers, trust your gut. Okay,
Yes.
Trust your gut. Trust the little guy in your gut. Go with what you think. Stand behind it. Make your decision and stand behind it. I may ask you, are you sure? And it's just, I want you to say that firmly, yes, I'm making that decision. Because Knowledge is empowering, and I want to empower each and every one of you. So I thank each and every one of you today for helping the viewers, future students here, orientating to simulation, and I know that they'll be seeing more of you guys as we go through our simulation. Thank you.
Good luck and have a great semester.